In April 2010, the South African government launched an HIV counselling and testing campaign. This campaign was launched by the President and led by the Deputy President in his capacity as chairperson of the South African National AIDS Council, SANAC. With the Health Minister championing the cause, the campaign sought to make HIV testing and screening for chronic diseases more accessible. This included screening for TB, blood pressure and blood sugar.
Today is an important day in our fight against HIV and AIDS, as we gather to launch our new upscaled HIV and AIDS prevention and treatment plan.
Our target is to test 15 million people by June 2011. Knowing your HIV status should enable you to change your behavior accordingly.
The campaign was in response to the high levels of HIV infection in the country, which currently sits at 5.6 million people living with HIV. The HIV epidemic is further burdened by high rates of TB and other diseases. Leading by example, the President publicly tested and urged the whole country to get tested to know their HIV status.
All of us in this country should know our status. So all of us must start testing, as I've done today.
Other public figures also joined in and showed their support for this campaign by testing publicly.
And Nagogi at that time is to encourage my soccer player, my soccer colleagues as well.
I would recommend that everybody knows their status and gets down to a testing station as soon as possible and have it done.
When ordinary people see that this disease affects everybody, even people they regard as famous and well-known, then they realize that is everybody's problem. They become very easy in participating.
The SANAC sectors, traditional leaders, state-owned enterprises, the private sector, civil society organizations, donor organizations and communicators came on board to mobilize communities to take up services offered by the campaign.
If we are HIV negative, we have to protect ourselves and make sure that we stay negative.
Well, the idea of the HCT campaign was conceived in the light of the new approach to HIV/AIDS in the country. We wanted to reach as many South Africans as possible, not only those who are aware, even those who may not be aware, who might not even have heard about HIV and AIDS, or who might have heard just through a rumor. You go to them, speak to them, and encourage them that it's important for them to test.
The campaign was successful at highlighting the importance of HIV testing and getting people to access other health services, including treatment for HIV and TB, medical male circumcision, prevention of mother-to-child transmission of HIV, and promoted HIV prevention in general.
Testing for HIV is not just for its own sake. Knowing one's status is the most important entry point for treatment, care and support. Knowing one's status empowers one to consider ways to reduce the risk of infecting others. More importantly, knowing your status empowers us to lead a healthy lifestyle.
By the end of June 2011, 13.7 million South Africans answered the call to get tested. The campaign has opened dialogue for South Africans to reflect on how to live healthy and protect themselves and others, as well as in breaking the stigma around people living with HIV.
Today, I stand before you as one of those people who took this test in 2001, and I know my status, and I've taken leadership, and I'm one of those people who live with HIV, and that test saved my life.
Acknowledging that we have to treat those who are HIV positive, prevention still remains the key cornerstone of us dealing with this epidemic.
The success of the campaign is a clear demonstration that the collective efforts of government, civil society and the private sector can achieve the goals set out in the country's national strategic plan.
The HCT campaign achieved a lot. It changed the manner in which people understand HIV and AIDS. It changed the total platform of treatment and care of the HIV and AIDS in the country.
I am responsible. You are responsible. we are responsible to ensure a long and healthy life for all South Africans.